The prostaglandin, are also responsible for pain, fever, and inflammation. Prostaglandin, they are analgesic, produce pyrexia and inflammation. Once phospholipase, arachidonic acid produce arachidonics producing prostaglandin acting on EP3 receptor. When this is EP3 receptor stimulated, it increasing the release of pyrogen. When pyrogen is increased, it increasing the interleukin 1 interact with the receptor, increasing body temperature. This is known as pyrexia. Prostaglandin acts with the receptor at sensory ending, and this sensory ending is stimulated and go message to the brain and producing pain. Second mechanism, it stimulating the local pain receptor, and these local pain receptor are responsible for pain. This prostaglandin may cause contraction or dilation, increase prostaglandin among endothelial cells, increase gap among the endothelial cells, producing increasing fluid oozing, and this is known this creating redness, hotness, and swelling. And this redness, hotness, swelling is known as inflammation. Once we are using NSAIDs or steroid, so there is a inhibition of COX pathway, and this inhibition of PL enzyme, and inhibition of temperature, pain, and inflammation. Prostaglandin antagonist NSAIDs, they are COX inhibitor. Steroid producing peptide lipocortin. This lipocortin then inhibiting phospholipase A2. This phospholipase A2 inhibition leading to prostaglandin inhibition, and there is inhibition of pain, fever, and inflammation. Polyfluoroethane phosphate and oxaprostanoic acid. These are the specific selective prostaglandin receptor antagonists, but they are still in clinical trials. Thank you for listening.